Hi, I'm Dr. Hussein Musa.
Hi, I'm Dr. Adatone Musa.
Welcome to Healing Talks with Kingdom Docs.
Today we are going to talk about health and fitness and how it applies to overall health, but also specific medical problems like seizures, epilepsy, and chronic pain.
Yes. Now, we know that our diet, our nutrition can have a huge effect on our bodies and weight gain, and that can lead to chronic pain, but also exercise. There's a specific important benefits from exercise. One thing that I like to note is the mood. Now, when you exercise, it's actually pretty hard to be depressed when you exercise because you're going to get a rush of endorphins and these feel-good hormones that, although most of us are dreading starting to exercise, it's very rare to find a person who, after they exercise, really regret doing it, unless they injured themselves.
Yes, the endorphins are such a wonderful part of the human body. It's a feel-good molecule, and it does help with chronic pain. It can help with headache disorders and migraine, and there are studies that show that it reduces migraine frequency, regular exercise.
Yeah, now I think that's the key, is regular exercise.
Yeah.
As we talked about, these habits can be very challenging to form, but it really starts with the decision. And I think it's important to start small, and having a physician who is leading part of your treatment plan, who has the time to encourage and educate you, I think that could really improve your compliance with whatever exercise regimen you decide to embark upon.
Yeah, it's all about accountability. So having a physician who's touching base with you regularly, asking how you're doing, being available to give you strategies for success, it's something that's huge, and it really helps patients, I think, increase their confidence when they're tackling these problems with dietary changes or with exercise.
Yes, and this is part of the strategy to promote healing instead of disease management, working with the entire patient, mind, body, and spirit, and including other avenues of treatment, including nutrition and exercise. Yes, exercise can be as important as any medication that your physician prescribes.
So, just to add to that, since I'm such a nerdy person, I love to read different scientific studies because I want to know what's out there with preventative medicine and also with exercise physiology. And there have been so many studies coming out that also show that exercise, it doesn't only reduce weight and cholesterol and things like that. It can reduce seizure frequency. In fact, there are some studies that show that electrically in the brain, it reduces something called seizure discharges or epileptic discharges. And these are electrical events in the brain that may lead to seizures. So imagine regular exercise reducing those events in the brain. That's amazing.
Wow, that's making the treadmill look even more important.
Yeah. Now, safety first. With epilepsy patients, there are many things that they can participate in to increase their physical activity, but it's also important not to climb high heights or anything like that because of the risk of falling. But things like running or going for a walk or Pilates, all of those things can increase their activity level and also reduce seizures.
I just really like what you said, that exercise can actually change your brain. I think that's fascinating.
It is, yeah.
It's not just the habits, but there's physical evidence we can see from the benefits of exercising and stewarding your body in a way that glorifies God.
Yes. Well, thank you guys so much for joining us on Healing Talks with Kingdom Docs.
Please visit us at kingdomdocs.com.
Bye-bye.